practice of censoring science, of suppressing science, with simple changes in the vaccine schedule, such as delaying vaccines, getting out the metals such as aluminum and mercury, separating the shots, that they can reduce the amount of adverse events. This is the mandate of Congress in 1986, when Congress passed a law with a mandate for safer childhood vaccines. This has never been carried out because the government officials are simply afraid of the results. At this point, it's gone beyond regulatory misconduct, I think, to criminal negligence, because the government, it is incumbent on the government to release this information, to fund these kind of studies on an ongoing basis, so that we will have the information we can to change the schedule and to give parents the proper informed consent.
The U.S. military is making plans for a major outbreak of swine flu. Troops will be used to help civilian authorities, but there are also preparations being made to protect military forces from catching and spreading the disease within their ranks. Marianne Silver is live in Atlanta now. And Marianne, why is the military so concerned, and what led to this type of action to try and stop the spread?
Hi, Kelly. The military has confirmed over 2,300 cases of swine flu among active duty troops. And if you add to that some of the family members of active duty troops, it's over 3,800. So they're very concerned about it spreading. You know, a lot of military personnel work in close contact with each other, often, working in the same office and even bunking together. So just like what we've seen over the summer with those kids in summer camps, the virus spreading quickly, they're worried about the same thing happening to the military. And they want to get a handle on it because the military has offered to be there to provide testing for H1N1 to the public and also to distribute vaccines once they've been developed. I mean, they've offered their resources, so they want to be ready just in case something happens.
Yeah, and to some it may sound unusual, but it really isn't. You're taking all those kinds of precautions to make sure it doesn't spread. But like military troops, Marianne, young people, they seem to be at a greater risk for swine flu, with kids going back to school now in the fall. What are health officials saying about that scenario?
Well, Kelly, that is a big concern. CDC officials announced earlier this week that they are worried that we're going to see a huge increase in the number of cases, even more so than what we saw in the spring when everything started, because kids are going to be going back to school. They identified hundreds of cases in kids that attended summer camps over the summer. That's got them worried because the kids, of course, in classrooms are going to be in close contact with each other, and they're racing right now to get a vaccine available. They're going to have 40 million doses, they hope, by September, and another 120 million by mid-October, and they're hoping that that's going to hopefully help keep it from spreading if they can get some people vaccinated.
Absolutely, and you can be sure that a lot of parents out there are indeed very concerned about this one. Marianne Silver, live in Atlanta. Thank you, Marianne. Good to see you.
Hello, welcome to Washington Unplugged. I'm Cheryl Atkinson. If you've been diagnosed with probable or presumed 2009 H1N1 or swine flu in recent months, you may be surprised to know this. The odds are you didn't have H1N1 flu. In fact, you probably didn't have flu at all. That's according to state-by-state test results obtained in our 3-month-long CBS News investigation. In short, only a small fraction of cases that doctors flagged as most likely to be swine flu actually tested positive for swine flu at state labs. The vast majority of the cases were negative.
The president now declaring the H1N1 outbreak a national emergency. The White House says the president signed this proclamation last night. It will allow medical officials to bypass certain federal requirements. Some officials describe this move as being similar to a declaration ahead of a hurricane making landfall, but certainly a heads up on the White House's front on this. For more on the president's H1N1 emergency declaration, we're going to MSNBC's Mike Vaquera live at the White House. So can you put this in perspective for us? We hear these declarations before a hurricane makes landfall. Right. They're national emergencies. It waives certain federal requirements. How does this work in a health situation like this?
Well, it's relatively rare for this to be declared in a health situation. We know this much because last April, when the H1N1 virus first came to the fore of public consciousness, a similar step happened. Federal officials were quick to point out that there's no reason for this to make anybody panic. This is simply something that we're doing in terms of preparation. A lot of it has to do with the logistics. Of course, it all happens in the context of a slow delivery of the H1N1 virus. Expectations were raised high. Everybody thought there would be more doses. doses. You've been talking about it all morning, Alex, and now they're talking about November. The government thus far has blamed that on the manufacturers. Let me read you a little bit from the proclamation here that President Obama signed last night, incidentally. It was just made public this morning. The president says, as a nation, we've prepared at all levels of government. Then he goes on, nevertheless, the 2009 H1N1 pandemic continues to evolve. The rates of illness continue to rise rapidly within many communities across the nation, and the potential exists for the pandemic to overburden healthcare resources in some localities. Thus, in recognition of the continuing progression of the pandemic and in further preparation as a nation, we're taking additional steps to facilitate our response. And he goes on later to reiterate that this illness may overburden healthcare resources. We've already seen lines. A lot of that has to do with the shortage and the shortfall of the vaccine, which they had expected to see more of at this point in the process.
Right, okay, and of course the White House has no control at this point over the development of that vaccine. That is something that scientists and medical officials certainly do, and apparently for many that can't get out there fast enough. Okay, Mike Bakira, thank you very much for the update on the breaking news from the White House. And for the latest on the government's response to the H1N1 outbreak, you can all log on to flu.gov.
They wouldn't answer Freedom of Information requests that we filed. They wouldn't answer questions that we posed to them. And we approached Dr. Frieden, who heads CDC, at an unrelated news conference to confront him about this lack of information. Here's that tape.
I'm Dr. Frieden. I'm Fernando Suarez with CBS News. I work with Cheryl Atkinson from our investigative department. This is on a separate issue. For weeks, we've been trying to get information from your office on the state-by-state breakdown of the H1N1 virus, and your office has been obstructing the release of that information. Can you assure us that you would personally look into this so that we can get that public information released today?
We will certainly look into it. We do work in partnership with states and coordinate with them on release of data that is data reported to CDC by state governments. So it's a question of coordinating with the states on release of information. I'd like to see if there are other questions, perhaps, on the...
One last question. The information is available to the CDC right now. What can we do to get that information released to us? Today, your office has stopped communicating with us about this issue, so we had to come down here to ask you personally to get involved.
I am aware of the issue. We are discussing with states because some of the states have provided to us preliminary or incomplete data, and we need to make sure that any data we release to the public is accurate and that the entities that have reported are comfortable that that data actually represents what they intended to report. So once we are comfortable in that, we will be happy to release it to you. I do not know whether that will be today or not. Are there other questions about the prevention, communities putting prevention to work?
Now, while we waited to get data from CDC, which we eventually did, but in the meantime, we contacted all 50 states directly. I just want to give you a couple of samples of what we found. In California, they took 13,000 specimens, and of those, 296 were swine flu, 12% were other flu, 86% were negative for flu altogether. And in Florida, they had 8,000 specimens, more than that actually. 17% proved to be, upon further testing, H1N1. 83% were negative. In Alaska, 1% was swine flu. And in Georgia, 2.4% was swine flu. The rest were negative for swine flu. We want to make sure that people understand we're not trying to downplay the seriousness of swine flu, which it can be very serious, but there's a risk of overreacting.
Just as it sounds, this is an influenza virus that is commonly seen in pigs. However, in rare occurrences, the virus does cause infections in humans. Swine influenza infections typically look clinically much like seasonal influenza, having symptoms such as fever, cough, sore throat, and muscle aches. Sometimes additional symptoms such as diarrhea or red eyes are also present. Typically, in swine influenza cases, there is evidence or there's information leading to that the individual had direct contact with pigs. This strain of swine influenza that's been cultured in the laboratory is something that's not been seen anywhere actually in the United States and the world. So this is actually a new strain of influenza that's been identified.
Really do your research and know that, number one, you have a right to make this decision. No government should ever force us. And please don't make this decision based out of fear.
This change to a higher phase of alert is a signal to governments, to ministries of health and other ministries, to the pharmaceutical industry and the business community that certain actions now should be undertaken with increased urgency.